Hi, this is Alyssa with Midwest Healthcare Career Training Development. We're going to demonstrate a procedure for the Certified Nurse Assistant Program. The procedure is number 35, bed shampoo. So I already have my supplies, and actually I already did the initial step. So I did the initial step. I gathered my supplies. The supplies are: I have a basin, I have my shampoo, I have a mirror, comb and brush. I also have a dryer, hair dryer if needed. And then I also have the shampoo device. The shampoo device, I'm going to use this device according to the manufacturer's instruction. And then I also need a pair of gloves. So I go ahead and put my gloves on. I already washed my hands, so I'm going to put my gloves on. The first thing that I did is I do have a towel. I have a towel that's around the patient's shoulder and back, because what this does is it protects the patient's garments, because we don't want, during this procedure, we want the patient to stay dry. So I have my towel in place. As I said before, I have my shampoo device in place. This device that I'm using, what it does is it allows the water to drain. I have a nightstand and a basin in the back to catch the water. And so what I'll do now is that I'm going to just gently comb the patient's hair, because I want to make sure that there's no tangles or no difficulty with the patient, because I don't want to cause the patient any irritation when I begin the procedure. And so I have the towel around the patient's neck. And then what I'll do next is I have the basin. I have the water in the basin, and I did check with the patient. The patient did determine that the water is comfortable. That's important too, because we want to make sure the temperature is comfortable for the patient's touch. And so then my next step would be to now I just want to gently wet the patient's hair. So I have a cup of water here. So I'll just gently make sure that the patient's hair is completely wet. And so then my next step is I'm just going to take soap, going to gather it in my hand. I do have the resident's hair is wet, so I'm just going to make sure that I put soap over her, through her hair. And then with my fingertips, I'm going to just massage her scalp. You know, I wouldn't use my fingernails to massage the scalp, because I don't want to provide any injury or irritation to the scalp. And so then my next step would be to, so now I'm just going to rinse her hair. So I grab some more, I have a cup of water. I just make sure that I rinse the hair. You know, I might need another cup to just rinse the hair. So now her hair is rinsed. And then I do have shampoo, conditioner too if needed. And that's at the patient's discretion if they want the conditioner. And so then what I'm going to do, I have an extra towel. I'm going to just squeeze the excess water out. Like I said, the bed shampoo device that I'm using, all the water drains. I have a basin right here at the head of the bed to catch any excess water. One thing that I need is an extra dry towel. So I do have extra dry towel, and this one is I just want to make sure that her hair is completely dry. So I'll just take the dry towel, make sure I have the hair completely dry. So I'm done with this towel. I'll put it in the dirty linen. So then at this point, what I'll do is I'll go ahead and comb the hair out. I'll comb and brush the hair, just make sure, I just want to make sure that it's not tangled. And at the same time, during this entire procedure, I want to make sure that I maintain the patient's dignity and privacy. So I have the hair is washed, it's damp. I have combed all the kinks out, and then now what I can do is I have the hair dryer. So at this point, I'll take the hair dryer and I'll just make sure that the patient's hair is dry. And so that completes procedure number 35, which is bad shampoo. So now what I'll do is I'll just make sure that I get rid of all of the my equipment. I'll make sure that I get rid of the basin. Get rid of the basin and all the equipment that I use. I'll put her hair, her comb and brush back in its place, the shampoo, the mirror. And then, so now I'll do the final step. And the final step is I just want to make sure that the patient is comfortable, make sure that the call light is in reach. I'll make sure that her water and her nightstand is clean, and that her drinking water with the straw is in place. And so then I also want to do the visual check too, to make sure the environment is safe. And it's important for me to do the final step, because I want to make sure before I leave the room that the patient has everything that she needs. So before I leave the room, I'll make sure that I get rid of my gloves, and I would wash my hands. So that completes procedure number 35, bad shampoo, for the Certified Nurse Assistant Training Program. Thank you.